Most people think health starts with food, exercise, sleep, or blood work. And of course, those things matter. But there is one part of the body that most people still treat as if it were separate from everything else. Your mouth. Not just your teeth, not just your gums, your mouth as part of a living system connected to the rest of your body. And that matters. Because if we want to talk seriously about prevention, long-term well-being, and longevity, we cannot keep thinking about oral health as if it were just a cosmetic issue, or something limited to pain, cavities, or cleaning. There is a bigger conversation here, and it starts in your mouth. One of the biggest problems in modern health is fragmentation. One professional looks at the heart, another looks at the gut, another looks at hormones, another looks at the brain, and dentistry is often placed in its own separate box. But the body does not work in boxes. The body works as a network, and the mouth is one of the most biologically active gateways in that network. That is the first idea I want you to remember. A mouth is not outside the body, it is part of the body. Inside the mouth, we have soft tissues, hard tissues, bone, saliva, immune activity, blood supply, nerves, mechanical forces, and a very complex microbial ecosystem. In other words, this is not a passive space. It is dynamic all the time. You eat through it, you breathe through it, you speak through it. You expose it to stress, sugar, acids, bacteria, dehydration, and inflammation. And yet many people still think oral health only matters when something hurts. When people hear the word dentistry, they often think about repair, a filling, a crown, an implant, a cleaning. But what interests me more is not only repair, it is what oral health may be telling us before things become obvious. Because sometimes the mouth is not just a place where problems happen. Sometimes it is a place where patterns begin to show. Not always, not in every patient, not in a simplistic way, but often enough that we should pay attention. For example, if someone has persistent gum inflammation, frequent bleeding when brushing, chronic plaque accumulation, dry mouth, repeated infections, or signs of wear and dysfunction, I do not see that as just a local problem. I see that as information about habits, about environment, about biology, about stress, recovery, breathing, diet, hygiene, and systemic burden. Again, that does not mean the mouth explains everything, but it may be revealing part of the picture. And that is exactly where this channel begins. Let's take a simple example. If your gums bleed every time you brush your teeth, many people ignore it. They think it's normal. They think it's because they brushed too hard, or they think it's nothing serious. But healthy gums are not supposed to bleed routinely. Bleeding is a sign. It means the tissues are reacting. And once you start thinking in that way, you begin to understand something important. The question is whether we are trained to see them. Now, let's go one step deeper. Why does this matter in a conversation about longevity? Because longevity is not just about lifespan, it is about health span. It is about how well your body functions over time. It is about resilience. It is about prevention. It is about reducing the accumulation of avoidable problems. And when we think like that, small chronic issues become much more important, not because they are dramatic, but because they are persistent. That is a very different mindset. Longevity is not built only by doing one spectacular thing right. Very often, it is shaped by whether we ignore or address small problems early enough. And oral health belongs in that conversation. There is increasing interest in the relationship between oral conditions, the oral microbiome, inflammation, and broader systemic processes. This field is evolving, and we should be careful not to exaggerate. But being careful does not mean being indifferent. It means being precise. It means saying, the mouth may influence more than most people think, and it deserves a higher level of attention than it usually gets. That is a serious position, a responsible position, and in my view, a modern position. Your mouth contains an enormous number of microorganisms. Many are part of a normal ecosystem. That is not the problem. The question is balance. When that ecosystem becomes disturbed, when oral hygiene is poor, when inflammation becomes chronic, or when tissues are repeatedly stressed, that local environment may become less healthy and less stable. And that is where dentistry becomes much more interesting than most people realize. Because now we are no longer talking only about fixing teeth. We are talking about maintaining a healthier environment, a healthier interface between the external world and the internal body. That is a much bigger idea. Your mouth contains an enormous number of microorganisms. Many are part of a normal ecosystem. That is not the problem. When that ecosystem becomes disturbed, when oral hygiene is poor, when inflammation becomes chronic, or when tissues are repeatedly stressed, that local environment may become less healthy and less stable. And that is where dentistry becomes much more interesting than most people realize. Because now we are no longer talking only about fixing teeth. We are talking about maintaining a healthier environment, a healthier interface between the external world and the internal body. That is a much bigger idea. Think about it this way. If somebody is trying to improve sleep, reduce inflammatory load, optimize recovery, improve nutrition, support healthy aging, and think preventively about the future, but completely ignores the condition of the mouth, then there is a blind spot in the strategy. Maybe a small one, maybe a relevant one. That depends on the individual case. But it is a blind spot. And this is what I want to challenge from the very first episode. The old idea that the mouth is somehow secondary, that you can separate oral health from real health. That is outdated. Another reason this matters is timing. By the time many people finally seek dental treatment, the problem has often been developing for a long time. Not because they are careless, but because oral disease can be silent. Gum inflammation can progress gradually. Wear can happen slowly. Bone loss does not announce itself dramatically on day one. Changes in the mouth often build quietly. And that is one of the reasons prevention matters so much. Not fear, prevention. This channel is not about making extreme claims. It is not about saying every health issue starts in the mouth. That would be simplistic and irresponsible. What I am saying is more useful than that. I am saying the mouth deserves to be included in any serious conversation about long-term health. Because the future of health is not more fragmentation, it is better integration. We need medicine that connects systems. We need prevention that sees patterns earlier. We need dentistry that is not limited to repairing damage, but also helps people understand biology, function, inflammation, and long-term care. That is the future I believe in, and that is what dental longevity is about. If this is the first time you are hearing oral health discussed in this way, that is exactly why I created this channel. Not to create anxiety, not to oversell, but to build a more intelligent conversation. A conversation where the mouth is not ignored. A conversation where dentistry becomes part of a broader health framework. A conversation where prevention is valued before symptoms become obvious. Because in many areas of health, what hurts last may matter earlier than we think, and the mouth is a perfect example of that. So where do we go from here? In the next episodes, I want to explore this from different angles. The oral microbiome, inflammation, prevention, biological dentistry, how oral health may connect with overall well-being, what conventional dentistry does well, where the future is moving, and how patients can think more clearly and more critically about their own health. Because this is not about ideology. It is about better questions. And better questions lead to better decisions. And before we finish, let me properly introduce myself. My name is Dr. Mario Parra. I am a dentist, and my work is focused on a more integrative and future-oriented view of oral health. Over the years, I have become increasingly interested in the intersection between dentistry, prevention, innovation, and long-term well-being. That includes not only clinical dentistry, but also how oral health fits into a broader conversation about health span, longevity, and modern wellness. This channel is where I will share that vision with you, not as hype, not as medical sensationalism, but as a thoughtful, evolving, evidence-aware conversation about where dentistry is going and why it matters. So if you care about prevention, if you care about wellness, and about the future of health, you should care about the mouth, because sometimes the place we overlook the most is the place where the conversation should begin. And in many cases, this starts in your mouth. Thank you for being here. Welcome to the Dental Longevity Show.